How do families understand a variant of unknown significance? Imagine opening a genetic report and seeing a change in your DNA that you've never heard of before. It's called a variant of unknown significance, or VUS, and it can feel confusing. Families often wonder what this means for their health. A VUS is a genetic change found during testing where experts aren't sure if it's linked to a health problem or if it's harmless. This uncertainty happens because there isn't enough information about the variant's effects or how common it is in the population. Families learn that a VUS is like a gray area in genetic testing results. It means the change could be related to a disease, but current knowledge doesn't confirm it. The classification of a VUS depends on the data available, which can be limited, especially for rare variants or those in populations that haven't been studied much. To better understand a VUS, families often undergo additional testing. This might include testing other family members to see if they carry the same variant and if they have or don't have related health conditions. If relatives with the disease also have the variant, it might suggest a link. Sometimes, labs do more research or functional studies to see how the variant affects gene function. This can help clarify if the change is likely to cause disease or not. Over time, as scientists gather more genetic information, the classification of the VUS can change. It might be reclassified as benign, meaning harmless, or pathogenic, meaning disease-causing. Families should know that a VUS on its own isn't used to make medical decisions. It's important to work with genetic counselors or healthcare providers who can interpret these results and suggest next steps. Understanding the limits of genetic testing is key. Since science keeps evolving, what's uncertain today might be clearer tomorrow. Families are encouraged to stay in touch with their healthcare team for updates. They can also consider participating in research studies that help improve understanding of genetic variants across different groups. In the end, families see a VUS as an uncertain finding that needs ongoing evaluation. It's a reason to keep testing, gather more family information, and seek expert guidance. This approach fits within the bigger picture of understanding the limits of genetic testing and highlights the importance of careful interpretation and ongoing communication.